Prognosis of second molars with external root resorption caused by impacted third molar by Q et al. In 2022. The aim of this study was to evaluate the prognosis of second molars with external root resorption caused by impacted third molars. The impacted third molars were extracted and they explore related predictors. For the methodology, they used 58 participants who had asymptomatic second molars with apical external root resorption caused by impacted third molar. The impacted third molar were extracted and follow-up examinations were conducted at 1 week, 4 weeks, and 6 months. The inclusion criteria were asymptomatic second molars with apical external root resorption caused by impacted third molar with normal pulp and with stage 1 or 2 periodontitis. The degree of external root resorption was graded as mild, moderate, and severe. The follow-up examination were at least 6 months post-operatively. Clinical examination and sensitivity test was done immediately and before extraction of the third molar and 7 days, 1 month, and 6 months post-operatively. The clinical examination include inspection, palpation, and percussion as well as assessment of mobility signs and symptoms. Cold and heat tests were used to check the pulp sensibility. Radiographic examination was performed at least 6 months after the extraction. The success outcome was to have a normal response to heat and cold test following the extraction of impacted third molar, and a failed outcome was defined as a second molar that developed symptoms and required root canal treatment or extraction. For the result, after 6 months of follow-up, the majority of second molars remained asymptomatic and showed a normal response to heat and cold, which was 89%. The failed cases was 6 teeth with the patient aged more than 30 years old and defined as failure. In summary, the result of this study indicates that the most asymptomatic external root resorption for second molars caused by impacted third molars remained vital and functional without further intervention after the extraction of impacted third molar.